Hello and welcome to NAFDAC and Your Health, where we bring you all the important information you need to know about the regulatory activities of NAFDAC, that agency that has the constitutional mandate to safeguard the health of the nation by ensuring that the food, drugs, cosmetics, chemicals, and medical devices made available to us are safe and wholesome. My name is Opejemi Urimolade. This episode of NAFDAC and Your Health is basically focusing on combating substandard and falsified drugs through traceability. We will be bringing highlights from the unveiling of the traceability solution providers that took place recently in Lagos. This will be followed by updates of NAFDAC's activities in some parts of the country. In advancing in the strides towards tackling substandard and falsified medicine, NAFDAC began to harness digital technology by introducing strategy of track and trace in 2024. However, NAFDAC has further gone ahead to consolidate and strengthen the track and trace innovation by unveiling solution providers that will lend the needed support in the implementation of the innovation. The unveiling of the solution providers took place recently in Lagos. In her opening remark at the occasion, the Director General of NAFDAC, Professor Mojisola Adeyeye, spoke about the significance of the unveiling.
It is with great pleasure that I welcome you all to this important event, the unveiling of the solution providers who will support the implementation of the phase 2 of our pharmaceutical product traceability, private sector scalable pilots. We have been doing the public about 4 or 5 years now since the pandemic. Now we are scaling it up from the narcotics now to MNCA products. Today represents a significant step forward in our shared commitment to safeguarding public health, particularly around maternal, newborn, and child health and nutrition products. Traceability is more than a regulatory requirement. It is a public health imperative. With the increasing threat of substandard and falsified medical products, especially within vulnerable populations, the need for a reliable and transparent pharmaceutical supply chain is paramount. The gazetting of our pharmaceutical product traceability regulations in October 2024 signals NAFDAC's unwavering resolve to harness technology to protect lives and enhance accountability across the health sector.
The DG also expressed her gratitude to market authorization holders for keying into the initiative. She also commended them for their cooperation and readiness to work with the solution providers.
To the solution providers that have been waiting for a while for today to happen, we recognize the value that you bring. You've gone through the training by GS1 Nigeria. Your technical expertise and commitment to interoperability will play a central role in demonstrating that traceability is achievable, efficient, and impactful within our local context and across national borders.
Earlier in his welcome address, the head of Traceability Office of NAFDAC and Special Assistant to the NAFDAC DG, Mr. Gbenga Fajemirokun, gave the trajectory of the journey of NAFDAC traceability. Mr. Fajemirokun also spoke on the focus of the second phase of the implementation of track and trace.
Building on the success of the phase 1 pilot, we are gathered here today to launch the phase 2 pilot of the traceability project and to unveil to the public the solution providers that have been selected to guide the industry through this process. Please, I want us to note that these are solution providers that have gone through scrutiny. They've been certified by our technical partner, GS1. This second phase of the track and trace implementation focuses on maternal, newborn, and child health and nutrition products. Collectively regarded as MNCH and M products, they are essential for preventing and treating life-threatening conditions in mothers, newborns, and children, thus reducing mortality rates. They help ensure that mothers and children receive the care they need to thrive, leading to better overall health and development.
You've been watching NAFDAC and Your Health. We will be right back. Please stay tuned.
NAFDAC has observed with dismay the wanton illegality of unlicensed vendors peddling drugs to unsuspecting members of the public, despite efforts aimed at tackling the menace of drug hawking. NAFDAC hereby advises the general public to desist from buying drugs from these merchants of death. Drugs sold by hawkers are fake, counterfeit, and substandard. The hawkers expose the drugs to inclement weather, which degrades their active ingredients since they are stored in conditions that render drugs poisonous. The drugs could therefore damage the liver and kidney or lead to the death of the consumer. Drug hawkers constitute threat to our national security. Hawking of drug is one of the main causes of drug abuse, as victims continue to fetch drugs from unregistered and unregulated hawkers. Consequently, drug abusers soon succumb to the dilemma of depression, personality disorders, suicidal thoughts, mental disorder, sleep problems, organ failure, damaged immune system, memory loss, anxiety, social and economic problems. NAFDAC hereby warns those involved in the nefarious act of hawking drugs to desist from this illegal act or face the wrath of the law. NAFDAC, safeguarding the health of the nation.
Welcome back to NAFDAC and Your Health.
There was also a presentation by Mr. John Kayode, the Assistant Director, Regulatory Innovation Unit and Lead, Technical Working Committee at the Traceability Office of NAFDAC, on the overview of Traceability Implementation Plan, Roadmap, Expected Outcomes, and the role of stakeholders.
Currently in Nigeria, the governance structure for traceability exists. We have a steering committee at the top of the pyramid, where the committee is co-chaired by the Federal Ministry of Health and then and NAFDAC, and then we have industry representatives in that committee. Quite a number of industry representatives even seated here are part of that committee, and that committee has been meeting. We also needed to strengthen the regulatory environment. Strengthening the regulatory environment required that we put in the regulations that we guide and tailor out what exactly every party is expected to comply with.
The accredited solution providers include Checkit, Sprogzil, AfriHealth, Newsoft PLC, PharmaSecure, Atsofon, Concepts PLC, and M Pedigree. Each of them took turns to talk about the wealth of experience in the digital innovation space and what they are introducing into the efficiency of traceability.
We do it in a way to enable brands, manufacturers become compliant, and even enable you to export your product to other markets, right, that have this compliance as a framework. Then we enable you to have end-to-end supply chain visibility. How? You serialize your product, leveraging GS1 standards. You can do this either by printing directly on a production line, integrating with your existing ERP systems. You can do this by printing stickers, if that's what you prefer. But we also offer machines, right? And these machines, you don't necessarily have to buy them. We can rent them to you, right? In addition, we integrate with global manufacturers, multinationals, that bring products from outside of Nigeria into the continent. We integrate with the existing systems and enable those serial codes that you've already printed on your product to be transferred into that database. So think of us as a multi-way, multi-channel of actually engaging, enabling you to easily serialize your product, because we don't think it should be difficult for you to do that. That's why we exist. We also integrate directly with NAFDAC system, but also we can enable your distributors to connect with your systems directly, receive using the web scanner, and ship using the web scanner, which gives you full-time visibility to stock levels across your supply chain in real time.
What does traceability require us to do? First of all, you might be able to print directly to the bag, and we also need to comply with the labeling guidelines from NAFDAC. And also at Sprozil, we have a solution which is called the Sprozil Informa Plus. That's our traceability application. And what does our traceability application do? We comply with this guideline. The Sprozil Informa Plus enables you to also be able to accept the GS1 standard and enable you to either apply directly on the pack and also apply labels in case you want to use that route.
We have a suite of solutions, like I said, and starting with the SID, which is a platform for patented code generation in the traceability way that manufacturers and other stakeholders have to register their details to be able to generate codes, and you can see the codes are just like exactly what it is. The industry standard, having the batch number, the serialization code a lot, the expiration, and then the GTO. One of the very important things in traceability is the aggregation. And if I need to explain this, it is the interaction between the parent-child relationship of different packaging hierarchies, whereby if you scan the top ones, it will definitely automatically tell what is in the power lines of inside the cartons. I'm sure a lot of you have heard about this already. KSID is a one-stop suite for hardware. It intelligently captures traceability and visibility from manufacturers to the point of sales or the point of dispense. Even as the case may be in the hospital.
All these devices that we have here, like the labels, those are the ones that they're going to use to print the barcodes or the QR code or the metadata on the label itself to be on the tubes of their medication, or maybe on the parts of their medication, depending on the side of it. This device, even though we're talking about counterfeit, now the service providers also, they need to use a well-accredited device that is already accredited by GS1 and not so NAFDAC. And the reason is, if you're trying to get away from counterfeit and you are using a counterfeit device also to scan, you're not going to get the not necessary thing that you needed. And one of the reasons why they're using Zebra, why they say Zebra is the factor device that they want to use, is because of the ruggedness of it, the security of
these printers, the inkjet printers for the manufacturer, the big manufacturers, those that have their whole manufacturing line, you can use those two. Now, for those ones that don't have, are not very big manufacturing units, we have the handheld for you. It's very it's very mobile, you can use it, it's easy to use. You have the scanners too, we have all those there. Then we have our web application and our mobile application for easy compliance.
Our architecture is built on GS1 standard for interoperability. And when I say interoperability, it simply means that wherever your manufacturer is around the world, you can plug in our system with your manufacturer and it's seamless. Then take you through the full cycle to support you. We don't just give you the solution and you just go. We walk through the solution, whereby from the beginning, onboarding the process, your products, your location, we onboard you, and also we take you through the process down to post-implementation, and also down to your downlines. And again, irrespective of who you are in the supply chain, multinational, national, there is SME, irrespective, we have the solution that can bring you in, and you will not feel less important because you are also dealing with multinationals.
To assure our
potential clients that we are ready for business. We are ready to invest heavily in this. We have a very robust solution that have been accredited by GS1, and we have people that are capable, that are well knowledgeable about traceability. Our system is able to, apart from validation, commissioning, and the serialization steps, we are able to geofence. We are able to, that means when your products are where they are not meant to be, we are able to alert you. And apart from that, we are also able to give you some insights, some business intelligence. If you want to know where your products are doing well, where you need to improve your marketing efforts, and so on and so forth.
The NAFDAC DG market authorization holders and other attendees took a tour of the exhibition stands of the solution providers to interact and better understand their respective technical peculiarities that have been introduced into track and trace.
And now, moving on to NAFDAC news updates. The National Agency for Food and Drug Administration and Control, NAFDAC, has issued a disclaimer concerning an audio recording recirculating on social media and messaging platforms, falsely alleging that the agency has shut down the manufacturing facility of Tummy Tummy Noodle in Anambra State and imposed a ban on tinned tomatoes and Maggi seasoning cube. The NAFDAC Director General, in the disclaimer issued, said the agency has categorically disclaimed the contents of this recording and dissociates herself from it in its entirety. The same audio first surfaced in October 2023 and was thoroughly investigated at the time. Contrary to the claims made in the recording, the Tummy Tummy Noodles facility in Anambra State was not sealed. A NAFDAC inspection team conducted an unscheduled visit to the facility, collected samples of 4 different noodle variants, and submitted them to the Agulu laboratory for evaluation. The results returned satisfactory with no infractions recorded. The individual who created the audio falsely claimed to be acting in collaboration with NAFDAC and alleged the presence of acetylmethyl as the preservative in the product. This was unfounded and misleading. NAFDAC found no evidence to support the claims and reiterates that the company was not in violation of any safety or regulatory standards. Furthermore, following the widespread concern in 2023 about the presence of ethylene oxide in instant noodles, NAFDAC conducted a comprehensive investigation at both factory and market levels. Findings made at the time confirmed that ethylene oxide or its derivative was not present in any instant noodles or seasonings produced in Nigeria. Additionally, mycotoxin levels and heavy metals were within internationally acceptable limits, confirming the safety of Nigerian-made noodles. NAFDAC also affirms that there is no ban on tinned tomatoes or Maggi seasoning cubes in Nigeria. The NAFDAC DG therefore urges the public to disregard the misleading audio and refrain from spreading unverified content. She added that NAFDAC remains proactive and committed to its mandate of safeguarding public health by ensuring that only safe, high quality and properly regulated food and drug products are available to Nigerians. The National Agency for Food and Drug Administration and Control, NAFDAC, has uncovered a warehouse in Kano State with over 88,000 liters of nitric and sulfuric acid known to be potentially used for the production of explosives and other dangerous weapons. The warehouse where the substances believed to have been imported illegally was found has been sealed.
These chemicals are ingredients that are used for manufacturing of explosives. And for us to have this number of liters by one person in one place is something very, very significant.
The total for sulfuric acid, which is about 90.5%, is 60 liters for the 60,000 liters. Did you get it? Okay, for nitric acid, which is about 68%, we have 28,560 liters combined.
The owner of the warehouse has absconded, but one person identified as the manager has been arrested. In a related operation, NAFDAC, in collaboration with the Nigerian Customs Service, Kano Jigawa Area Command, also recently destroyed 491,000 tablets of tramadol, a controlled substance with duty-paid value of 91 million naira. The destruction exercise took place at Aminu Kano Teaching Hospital.
We can see in this place an operation was carried out by customs. We intercepted 491,000 tablets of tramadol.
NAFDAC will continue to intensify surveillance and enforcement across Nigeria. The agency therefore urges the Nigerian public to report suspicious activities in their communities. The National Agency for Food and Drug Administration and Control, NAFDAC, has reacted to a misleading video circulating on social media, falsely alleging that the agency approved the registration of a herbal product claiming that smoking is healthy when used with their product. The agency categorically refutes this claim as false, baseless and completely unfounded, declaring that the product in question, Long Detox Tea or Longitox, or any similar product is not registered by NAFDAC. According to the press release signed by the NAFDAC Director General, Professor Mojisola Adeyeye, in 2023, an unscrupulous individual submitted an application to register an anti-smoke and long detox tea at NAFDAC's Lagos State office. Upon review, the application was rejected due to the unsubstantiated and dangerous claim that smoking could be made healthy by consuming the product. The applicant was asked to substantiate his claim, but the product was never resubmitted for processing. The press release further emphasized that the NAFDAC does not and will never permit the approval, importation, exportation, manufacture, advertisement, distribution or sale of any product that lacks a solid scientific basis or any product that poses a potential risk to public health. The claims made in the application were not only unscientific but also posed a significant danger to public health. As a science-driven and professional regulatory body, NAFDAC strictly enforces its mandates to protect public health, as outlined in the NAFDAC Act Cap N1 LFN 2004. All products under the agency's regulatory purview, food, drugs, cosmetics, medical devices, bottled water and chemicals are thoroughly evaluated for safety and quality and efficacy before approval. Additionally, the agency does not allow the use of pictorials of organs on product packaging or artwork as seen in the misleading product. NAFDAC in the press release reiterated that the clients who apply to register herbal products or any similar products are not permitted to make therapeutic claims unless those claims have been scientifically validated through proper clinical trials. Misleading and deceptive practices, especially those that endanger public health, will not be tolerated. The press release also stated that the agency remains resolute in its commitment to safeguarding public health by ensuring that only safe, effective, and scientifically substantiated products are approved. NAFDAC condemns any attempts by individuals or organizations to mislead the public or promote products with unfounded claims. In the meantime, the agency is not unmindful of the bogus and unsubstantiated allegations of financial inducement contained in the video. Ordinarily, this sort of claim will be ignored, particularly since the product was not registered by the agency. However, the Legal Services Directorate is reviewing the statements of financial compromise with the goal of seeking a redress in the law courts. This should serve as a deterrent to individuals who may choose to malign or make libelous statements against the agency in future. The general public is advised to disregard the misleading video and avoid patronizing any unregistered or suspicious products. That was NAFDAC Update. You have been updated.
That's all we have for you on this episode of the program. Do join us again next week for another insightful package. We look forward to receiving your complaints, comments, reports, and observations on the activities of peddlers of unwholesome food products, fake, unapproved or expired drugs, cosmetics, medical devices, and chemicals. We are easily accessible.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Don't forget, importing, producing, advertising, distributing, and selling of unwholesome, fake, expired, or adulterated food products, drugs, cosmetics, and chemicals are criminal acts as they pose great danger to human health. Join the fight against these crimes by reporting all suspicious activities in your area to NAFDAC. Let's all be part of the effort to safeguard the health of the nation. Till we return next week, stay safe.